All right, ladies and gentlemen, it's 3 p.m. It's 3 p.m. right now. So coming up next, we will be diving into a topic that's both common and also very popular: flashes and floaters. When is it a concern? That's something I believe that many of us experience at some point. And small spakes or flickers in our vision, and often we tend to ignore them. But understanding the difference between what's harmless and what could be a warning sign is crucial. And that's why today we are very honored to have invited Dr. Noor Muhammad Rawi. She's a consultant ophthalmologist at KLI Specialist Center, and she is very, very experienced. So, ladies and gentlemen, can we give a big round of applause to welcome Dr. Ain?
Thank you. Okay. Imagine you are driving at night and suddenly you see some flickering of lights, or you can see some flashes that comes out of nowhere, or suddenly you see some flashes or some floaters that floats in front of your vision that just doesn't go away. So what will you do? Either you or you rush to see a doctor. So to help you to understand the symptoms better, either this is something mild that you can ignore, or you have to do something that you have to rush to see a doctor. All right? So thank you for the invitation, Focus Point.
Thank you for being here, Doctor.
It's an honor for me to be here as well. So I will be talking about 20 minutes. Maybe you can have a Q&A for 10 minutes. So any burning questions you can ask. All right.
So any questions is welcome at the end of the session. So just some introduction about our speaker, Dr. Ain.
Yeah, I have about 2 decades experience in ophthalmology. My subspecialty is in medical retina and uveitis. And I am passionate about eye health education and community outreach. So that's why I'm here today.
Wow.
All right, so this, yeah.
By the end of this talk, can you share with us what we will be sharing today?
Okay, so by the end of this talk, you will understand what are flashes and floaters, when are they harmless, and when you are not to worry. And then what conditions may cause them, what you should do if you or your loved ones experiences them, and how early detection can save your sight. So we go on to the next talk. Why should you care about floaters and flashes? Because ignoring floaters and flashes could lead to vision loss. It can
permanently.
It can lead to permanent vision loss. So timely checks can save sight.
So it's very important for us to know more about the symptoms and also what are the contributing causes for these floaters and flashes. So can you explain for us what are floaters and flashes? They are different, right?
Correct. So floaters are actually small shapes that appear in your vision, especially when you're looking at something bright. So they may look like black or gray specks. They may look like strings or cobwebs, like a cobweb.
Okay.
And it can move when you move your eyes.
Wow.
Yeah. So you feel like, what is this?
Yeah.
It can appear so sudden.
That sounds alarming.
Yeah, alarming,
quite worrying.
And quite annoying as well, because it moves when you move your eyes.
Yeah, so this is floaters.
Yes.
And let's look at the flashes.
All right.
Or would you like to explain using the
eyes?
picture over here? I saw a picture in the previous slide.
Easier for me to show it from this eye model. So this is our eye, okay? Inside the eye, we have what we call as vitreous.
Vitreous gel, is it?
Vitreous gel, correct. This vitreous gel. Okay, this vitreous gel is mainly made of collagen. So when we were young, the collagen is, of course, a lot. And everyone, as we grow older, the collagen deplete.
Yes, as we age.
As we age. That one is natural. It's not something abnormal.
Yeah.
It's not something which is dangerous, actually. But when the vitreous become liquefied, then you can see floaters because it moves. It moves. It just doesn't stay as when we were younger. So that's when you can see floaters. So actually, everyone can have floaters. Either it is very mild, or sometimes you don't aware of that.
Sometimes when we are tired.
Yes.
Oh.
Sometimes you didn't realize that you have that.
I see. But as we age, the problem can get worsened.
Correct.
So can you show us where is the vitreous gel located?
Here, this one inside the eyeball.
inside the eyeball,
It's a
the
huge-
entire
The
eyeball.
entire eyeball, yes.
Oh,
So it's
I
quite
see.
big. It occupies the whole area in our vitreous, in our eyeball cavity.
Okay, so that's a floaters
Yes.
explanation for. And how about our next slide?
Okay, flashes are bursts or streaks of light that appear in your vision. It can feel like lightning streaks. If you see on the left you can see flashing lights in the eye. On the right, that is floaters. So flashes, you can see like camera flashing, like an old camera flashing. You can see flashes or lightning streaks or sparkles, especially in the dark. So what causes flashes is because when the gel, okay, you imagine that you are tugging your bedspread. Okay, if you pull it gently, it doesn't. It will just move. It will just stay there. If you tug it so, harsh, and then if when the flashes, if the flashes, sometimes the problem with floaters and flashes is that you can have retinal tear later. I will share it later in the next slide. So what is the problem with flashes? What is the cause of flashes is often caused by the vitreous gel pulling on the retina. The vitreous, as it become liquefied, it will pull on our retina. So this is our retina, the film of the eye. Yeah.
So under what kind of circumstances will this kind of condition happen? Maybe
Alright.
at night, especially at night.
Yeah. Actually, when you are in the dark, you can see the flashes more prominent.
Oh,
Yes.
okay. Yeah, that's true. That's true.
Yeah. All right. And then we move on to common causes. So common causes, most commonly is because of aging. So that one you don't have to be worried of. But there are certain cases that can lead to permanent visual loss because from retinal detachment. If let's say they have retinal tear that was not managed early, they can have retinal detachment. Imagine just now I told you that like a bedspread, you pull the bedspread, but you pull it very
In a hard way.
In a hard way, so it will be torn. It will be
Yeah.
torn. So just like our vitreous in the eye, when it is attached strongly on the retina, sometimes it will pull the retina and tear the retina.
Yeah, causing a tear.
Causing a tear. So what happened if you don't come early, and the doctor couldn't manage you early? What happened when there is a tear? The fluid will seep underneath the retina. So like
It will accumulate, is it?
accumulate. The fluid will accumulate, and then the retina will detach.
Oh,
Retina
causing the
will detach.
retina detachment.
Detachment. So when the retina detach further, that's when you can see that their vision is blur.
Oh,
It's not
that's why we will experience blurry vision.
Correct.
When the retina detachment happens. But usually when this kind of condition happen, we will experience some pain, right? We will know something is wrong, right?
Yes. Apart from floaters and flash, you can feel that your vision is blurry. It's like something covering your vision. So that's when you have to rush to see the doctor. Don't wait.
Don't wait. Once we experience, are you saying that once we experience flashes and floaters, we should immediately seek help, seek medical professional help? That's better, right? But later you will explain further
Correct,
for us.
correct.
All right. So that's for the age-related changes and
Yes.
retina tears and detachment. And how about the inflammation?
Inflammation, because when you have inflammation, you have white cells, inflammatory cells in the eyes. That's when you can cast shadow. You can see flashes. You can see floaters. It's like something covering your vision. And then it can be due to bleeding in the eye. You can have from eye trauma as well. For example, you have very serious eyes.
Yeah, injury. For example,
Yes.
maybe you in a car accident.
Correct.
For example.
Correct.
I see. So can I also ask the reasons behind the retina tears and detachment?
All right, I will show it after this. Maybe before I answer the question, I will inform when is it normal, so you will understand when is it abnormal.
Yeah. So for all the audience who always experience floaters and flashes, these questions this part is especially important. Let's pay
Yeah.
attention. When
Okay.
is the symptoms like flashes and floaters normal? Can you share with us, doctor?
Okay, when they are normal is when you can see occasional floaters. Sometimes you can see, sometimes you don't. And then floaters that don't change over time. So let's say you can see just about 1 to 2 dots of floaters, something floating in the eyes, and it remain for years. It doesn't change, so you don't have to worry. And then your vision is good. You can see clearly. You can drive without any problem. And some brief flashes in older adults without other symptoms. So the blood. So that's what I will inform after this. Okay?
That's
But-
why just now you mentioned the blurry vision.
Correct.
Yeah.
So, but still, even you have this, a proper checkup is recommended because you have to make sure it's not something dangerous.
Yes.
All right?
Especially if it is the condition of a retinal detachment, we should
Correct.
definitely visit a clinic or
Correct.
eye specialist immediately.
Yeah, retina detachment you can realize because you can see that your vision is blurry. But
Oh.
retinal tear you don't see your vision is
Immediately,
still good.
right?
Vision
It
is
takes
still good.
time.
It takes
Usually, how long does it take for retinal tear become detached?
detachment. There's no hard and fast rule.
Oh,
Yeah, there's no hard and
so
fast rule.
yeah. In
So
short, we should just seek
just-
medical help.
Correct. Rush to see your doctor.
Yeah.
Eye specialist. All right.
So when are they dangerous?
Okay, it's dangerous when you see sudden floaters. For example, you just see 2 times it's like a rain of floaters coming. So immediately. Or you see something covering your vision, like a curtain or shadow over your vision. It is frequent and with as well. And then you can see that your vision is blurry. That's when you have to come to see the eye doctor. And other than that, if you have other medical problem, for example, you had history of eye injury before, you had history of eye surgery done before, or you have underlying medical problem, especially diabetes. Because diabetes you
Can also
have,
cause-
can also cause. Diabetes is actually the most common cause of blinding condition in Malaysia. It's one of the top causes of blinding condition in Malaysia, and unfortunately, it could be irreversible.
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 Wow.
Yes. So actually, once you are diagnosed of diabetes, at least you have to meet the eye doctor for your eyes to be screened at least yearly.
At least yearly,
At
once
least
a
yearly.
year.
Correct.
Yeah,
Correct.
we should
Don't
pay
wait.
attention if you're diabetic for all the
Yes.
diabetic patients.
Correct.
So, doctor, these are all relevant to the frequencies and also how severe they are, right? And also, does it occur with other symptoms to tell that whether it's dangerous or not, right? The frequency
Yes,
and
the
how severe they
frequency,
are.
how severe they are, and then the vision. So all these points to emergency means it's a red flag. It's not something that you have to wait and see. You have to come immediately. So if let's say you have floaters and flashes with this medical condition, you had previous history of eye surgery, eye injury, you have diabetes, and you have high myopia, short-sightedness, means you are wearing high power for you to
High
see
power.
clearly at distance. That's when you have to come early. Don't wait.
Don't wait. Do not wait,
Do
in
not
short.
wait. Yes, correct. Okay. All right. Okay. So these are the red flags that I informed just now. Sudden shower of floaters, flashing lights that persist, dark shadow moving from side or top of vision. Dark shadow means the retina is already detached. Because when your retina is intact, you can't see the dark shadows usually. Okay, but when you see like curtain covering your vision, either from this side, from the down, from the right or left, just come.
There's an emergency.
Yes, it could be the retina detachment. It could be a
Oh,
retina
the dark
detachment.
shadow that
Yes.
you feel like you see the curtain dropping down.
Correct, correct. And then any decrease in vision, that could be sign of retinal detachment. Okay? It's an eye emergency. Because if, let's say, because you have what we call as macula, the sensitive part of the eye. That's when you sign your document, you drive, you want to eat, you can see everything. That is what we call as macula. Once it involves the macula, the vision will be, for the surgery to have a good outcome, it will be like 50-50.
Oh.
Rather than if it doesn't involve the macula. So the prognosis, the outcome is better. So don't wait until your vision becomes blur, especially at the center. Once it's blur something somewhere, from the side, you just come to see the eye doctor. Don't wait.
Yeah, seek professional medical help.
Correct. All right. Okay, next slide. Okay, so what is retinal detachment? Just now we informed that retina is detached. So what is it? Retinal detachment means the retina is is peeled away from the back of the eye. If you can see my pointer. That one. Correct. Thank you. And it can cause permanent vision loss if not treated early. So what are the symptoms? Apart from floaters and flashes, you can see the curtain over the vision and your vision is blur. Okay? All right. Next. So how we diagnose? So at our center, we have OCT. So this is the photo of our optical coherence tomography, OCT, where we can see. If, let's say, you have retinal tear, you can detect from the OCT, especially if it involves the center of the eye. We call that macula. And then you can, from the retinal photography, we can detect the retinal tear, we can detect the retinal detachment. And then, first thing first, after we see you, we will put dilating drops. So your eyes will be a bit blurry for about 4 to 6 hours. Okay, but you will return back to normal. You don't have to worry. Why? Because we really have to examine your eyes. Because when your pupil, which is where the light enter the eyes, is small, you couldn't see the whole pictures of the retina. So we have to put on the dilating drops. So when the eyes are dilated, we can examine the retina better. Yeah,
the area of the light entering your eyeball,
yes,
right?
Correct. And then if, let's say, you couldn't find, because you have bleeding in the eyes, what can we do? We have a B scan for us to detect dense floaters. For us, or if there is a bleeding, that's why we do the B scan. When we couldn't see the eyes, that is what we will do. We will do a B scan for the eyes. All right, next slide. Okay, so how do we treat it? If, let's say, you have floaters for mild cases, it's just age-related. It's a posterior vitreous detachment because of aging. You just monitor. We will see you serially, but you don't have to worry. We will inform you about there are a few alerts that you have to know. Sudden increase in floaters, flashes of lights, or reduce in vision. That's why you have to come. Otherwise, we can just monitor you at maybe monthly or 6 monthly, depends on the symptoms when you come.
So in short, when the symptoms occur, we can seek a medical help. But when doctors say you can keep monitoring yourself, then we can go home and keep monitoring.
Yes, keep monitoring. Right? So we will reassure you that it's not something dangerous. Okay, so we will treat based on the cause and urgency. So if, let's say, there is a retinal tear, we will laser on the same day itself. You don't wait. Because you are worried if the fluid will seep through underneath the retinal tear, that can cause retinal detachment. All right? And then, if needed, we will do a surgery. We call that vitrectomy. Means we will remove the vitreous. Yes.
Remove it entirely.
Yeah. We will do remove the vitreous. So especially when we will do, we don't touch the eyes unnecessarily. Only when there is vitreous hemorrhage or bleeding in the vitreous, then only we will do the vitrectomy surgery.
So once the vitreous extracted, what is the next step?
What is the next step? After we put, either the doctor will put in oil or gas or just air, depends on the nature.
To keep the eyeball intact?
Correct.
In shape?
Yes,
wow.
correct. And then we will monitor you. It will be a frequent follow-up for us to monitor.
I see.
So before that happens, that's why whenever you have acute onset of floaters or flashes, just come. Don't wait.
Just visit any eye specialist that's nearest to you.
Correct. All right. Okay. And then real life case example. Okay, so Mr. A is a 65-year-old man, came in with sudden onset of floaters and flashes of lights. And then when we see him, we can see this retinal tear. If I can point my pointer here, you can see there's a flap here. Yeah, so that is a retinal tear. So he was treated immediately with laser and his vision was fully preserved. So actually, early action can save his sight. So the one that you see, the white dots surrounding the retinal tear, are the laser marks.
Oh.
So we will do about 2 to 3 rows of laser to make sure that the tear is well barricaded. It has to be barricaded. We have to cover 360 degree.
So laser is applicable for all kinds of situation for retinal tear?
Yes, for retinal tear, we will do laser. There are many types of laser. If we couldn't reach, there will be other type of laser. So the doctor will decide which. So usually we will do a common laser that you will be seated on a slit lamp. We will have a laser machine to laser your eyes. Yeah.
Wow.
Usually it's not a painful procedure. And then it will last for less than half an 30
hour.
minutes.
Wow,
half
30
an hour.
minutes. That's
yeah,
quick.
Less than that. Quick. It's very quick.
Wow.
Yeah, it's really quick.
We have a question from the audience there. 100% safe.
For laser, yes, it's safe. Yeah, laser is actually safe. So basically, we will dilate your eyes, and then we will do the laser. We will instruct you not to move. There are a few side effects, but it's not that high. It's really low. If let's say you move your eyes, we might laser on the wrong place. So that's why we will ask you to just either you look up, look down, or just look straight so you don't move the eyes. Yeah.
And in case of emergency such as retinal tear, that's the only option we can go for.
Yes,
right.
yeah. If the doctor said that you have to be lasered,
Then
please,
you need to do it.
please follow. Because we are afraid that if you wait further, the fluid will come beneath the tear and it will detach the whole retina away. So that will be a bigger surgery.
Beyond
this one,
safe.
Yeah, this one is just a clinical procedure, less than half an hour, and your vision will be good. But if you wait, your vision will be worse. And if let's say you are still working, and then you are feeding your family members, so imagine the problem that you will face after that if you have.
Doctor, I have a question here. Usually when we experience the retinal tear, does it happen in your both eyes or maybe just one eyes?
Usually the God is nice to us. Usually it's one eye.
One eye only.
Yeah, one eye. But it can happen. So even in the eye, because the eye is 360 degree, right? If let's say you have tear at the front, the upper part of the eyes, it can happen on the right side, left side, down side. So even if you have been lasered, we will monitor you. Because as the gel is getting, when the gel is detaching, there will be 360 degree areas for it to pull.
Need to be taken care of.
Yes, it can be other sides that can be torn. So that's why you have to monitor.
Keep
Yeah,
monitoring for
correct.
maybe 3 months.
At least 6 months. At
least 6 months.
At least within the first 6 months of the acute onset. After that, if you feel that it is safe, then we can see a bit more longer. We can give longer appointment.
I see.
Yeah,
That's a
yeah.
good point.
Yes.
A real life case example shared by Dr. Ain.
Yeah. All right.
So
Okay.
we will
Come to
just
the end.
use come to
Yeah.
the end. The key message that we are trying to convey
Yeah.
to all the audience here today.
Don't ignore new onset of floaters or flashes, and then early detection can save your vision. Yeah.
Yeah, that's true. That's a very good point. I think sharing of today's session is meaningful and also very important for most of us because sometimes we might experience floaters and flashes, but sometimes we are not aware of the as it is and also the consequences. So it's very important for us to know what are the contributing causes and when should we visit a clinic or eye specialist. But the answer is always seek medical help if possible and as
Yes,
soon as possible.
Correct.
Yeah.
Especially when you have all these red flags that I've informed just now.
Yeah, the medical history, eye trauma,
Correct.
and also the sudden the drop over the vision.
Correct.
Yeah.
Yes, and blurry vision.
Yeah, blurry
Yeah,
vision.
And either from the side or at the center, just come early. Yeah.
Sudden decrease in your vision.
Correct.
Right.
Yeah. All right. So, any questions?
Do we
questions?
have any questions from the floor, from the audience? Just raise your hand. We're very happy to answer you. Any questions from the floor?
Yeah.
Earlier on, you mentioned short-sightedness. How high, the high power, right? How high would it be to cause a trouble?
Actually, once you have short-sightedness or myopia, you are at risk for retinal detachment. But of course, if you have higher myopia, means more than 500 diopter, means your power is minus 500 and above. So that's where the risk is even higher. Means because your eyeball is longer than normal. Just imagine our eyes like a balloon. When you blow the balloon, okay, when it is longer, okay, so the tense is there. So the gel, all the structures will become more loose compared to when the eyeball is a normal length. Yeah.
So, doctor, talking about a myopia, right? If high myopia and then I go for, let's say, a laser surgery to get it fixed so
Yeah.
that I don't have to wear glasses every day.
Uh-huh.
So, do I still stand at a very high risk of getting retina
Yes,
tests? Still.
yes, still.
Yeah, just that I can see clearly every day without
Correct.
glasses, but
Yes.
still I have very high risk of getting this.
Correct.
I
Because you know
see.
that in the initial state, your eyeball is already long.
It's
I mean,
already elongated.
elongated. So the laser is actually to replace the glasses or contact lenses.
Just to place something in your eyeball, in front of your eyeball to make you
Yes.
see clearer.
Yes.
But the shape of your eyeball
Is still the same.
remains,
The same.
long.
Yes, yes.
So that that's a permanent thing once we get
Correct.
myopia. Right?
Correct.
Okay.
Yeah.
Thank you so much for your
Okay,
sharing,
my
Doctor.
pleasure.
We still have one more questions from
Yeah.
the floor.
Doctor, actually, I can't go to have two eyes. I can't go to eyes. I can't go to hospital.
If let's say you have the eye problems,
No, sometimes I take out my glasses. I did not.
oh,
I can't go to hospital. No, no need.
okay, means if you take out, see clearly, you mean, right? Yeah, you can first, if let's say you have difficulty to go to the hospital, you can go to any optical shops, and then if let's say you, if let's say you have problems with your vision, it's easier for you to go to the eye specialist center. We have either hospital or the clinic setting. So for us, we are located within about 15 minutes from KLCC. It's not that far. Yeah, you can go to meet the eye doctor because we have specialists there, and we have the doctors to see your eye condition. If let's say you go to the optical shop and check your vision, but they could sometimes you don't have the equipment to examine your eyes fully, comprehensive eye examination. Yeah.
Yeah, maybe you can get a contact from Dr. N later, because a clinic, just now you said you mentioned you have a newly open clinic.
Yes,
Is it
yeah.
KL Eye Specialist?
Correct. It's located in Melawati. It's located next to Melawati Mall.
Oh, next to
So
Melawati
if
Mall.
let's say you are driving along MRT2, you can see the signboard, KLI Special Center at Melawati. It's next to Bank Islam. And it's really within walking distance from Melawati Mall.
Yeah, it's
Yeah.
nearer to KLCC, right?
Correct. Within 15 minutes from KLCC.
It's open already, or is opening soon?
Opening soon in early May.
Oh,
Yeah,
early May,
it's
the
really
first
soon.
week.
First week of May. Yeah.
First week of May.
Yeah, so we have comprehensive eye care there. We have, these are services. You can have comprehensive eye examination, general eye assessment. So when you say that you have blurred vision, if you take glasses, you couldn't see clearly, right? So you can come and meet us. We will do a full, we will examine your eyes and dilate your eyes as well. Yeah, and then for younger generation who are getting license for JPJ, if let's say you fail the exam, the vision test, you can come to meet us as well for us to rectify what is the problem.
Oh.
Yeah, and then cataract surgery, we do surgery as well. And then retina cases, glaucoma cases, macular degeneration, diabetic eye diseases, and subspecialty. My subspecialty, medical retina uveitis, we do treat as well. Yeah, even for children as well.
So it's like a full series of
Correct.
eye check and also
Yes.
even a surgery assessment.
Yes, yes.
Yeah.
So we are opening soon. So these are the opening special that we can offer to you. The first 100 patients, they can enjoy free consultation. And 200 patients will get 50% off for consultation fees. And the first 3 months cataract surgery is only at 2,500 ringgit.
Wow,
Yeah.
cataract surgery,
Yeah.
2.5.
Yes,
Your
yes.
vision, our priority.
Yes.
So this is
Okay.
the Melawati, and also you
Yeah.
have another
The HQ is
Center.
at Kepong.
Kapong.
Yes,
All right. So for all the friends staying nearby Kapong, you can visit the Kapong branch. And for those who would like to enjoy the opening of promos, you can visit the Melawati branch. KL Eye Specialist Center, Melawati.
Yeah.
So do we have any other questions from the floor? Anyone? If no, doctors, do you have anything to say? Your last word, in summary.
In summary, if let's say you have any visual symptoms, either floaters, flashes, or blurring of vision, just don't wait. Just see your eye doctors. Because you
Yeah.
wouldn't know when this happened. We don't want you to regret. You will ask yourself, why don't you go early? Or your loved ones, when they have these problems, don't wait.
Yeah, because
Yeah.
sight loss can be permanent.
Correct,
And if
correct.
you visit a clinic or eye specialist early, it
Yeah.
can save your vision.
Can
And
save
that
your
means a
vision.
lot to your life and also
Yes.
to your loved ones.
Correct.
Yeah.
Yeah.
Thank you so much for your
My
sharing,
pleasure.
Dr. Ann. Can we give a big round of applause to Doctor?
Thank you. Thank
Thank
you
you so much for sharing such valuable insights and also knowledge about the flashes and floaters with all of us here at Focus Point Roadshow. It's our honor to have you here. Thank you so much.
My pleasure.
So if
Thank
anyone
you.
have any other questions you'd like to get doctors consult in private, you can let her know. Thank you, everyone. Thank you for your attention. Thank you.